Hello and welcome as the Pet Safety Crusader takes another page out of the Pet Safety Bible and talks to you today about doing head-to-tail checkups. Actually, I'm taking several pages today. They're listed over in the post, but 49 through 51 in the first part of the book actually has an excellent chart. I know you can't see it from here, but that takes you through all of the body parts. And then 118 and 19 also has a narrative talking you through of how to do this head-to-tail checkup that I'm going to be talking to you about today. So make sure you have your copies of the Pet Safety Bible, and do know they will be coming out soon in both a Cat Safety Bible and a Dog Safety Bible edition for those of you that just have one species in your life. So the blog is on my website and gives you all of the details, but I'm just going to walk you through it a little bit. And I want to tell you that we do a head-to-tail checkup for two basic reasons. One is as a preventive, so that we can find something when it's small and get to the veterinarian and get it fixed before it becomes a nightmare for our loving best friend. The other time we do it is as an assessment when we already have determined something is not quite right. If the pet is ill or injured, we're going to give them a good check over to make sure we don't miss something else, or to try to figure out what in fact it is that could be bothering. Now remember, as pet first aiders, we are not veterinarians. Veterinarians are the experts, but most of us aren't lucky enough to have one Velcroed to the hip 24/7. So we need to know what to do at the time our dog or cat is injured or ill to make them more comfortable and to prevent further injury before we can get to veterinary care. Hey Barbara, nice to have you joining in. So I typically start at the head. You can certainly start at the tail. We can start at the middle. We can work to either end, whatever works. But the important thing is that you get your pets used to the human touch. It makes them so much better patients at the groomers, at the veterinarians, for your professional pet sitters. And I see one of those professional pet sitters just joined in. Hey, Scott, nice to have you with us. It's just so important that our animals are comfortable being touched by us, because if they always pull away or grimace or growl or hiss when we touch them, we're going to never know when something is sore and really bothering them. So it's important we're able to examine them, that we're able to get stuff out of their mouth that they shouldn't have in there, that we're able to trim the toenails or bandage a paw to take the temperature, all of those things. And I know in last week's episode, we talked about checking vitals. So I hope many of you have given it a go and have been able to get those baseline numbers on your pets. But for today's purposes, I am going to start at the head. And what I generally like to do is, if it's a long-eared dog, flip that ear up. If it's an upright ear, I don't have to do a whole lot. But just take a little sniff. Ears should not smell bad. And when they do, most likely it's a fungal or a yeast infection. So we need to get to veterinary care. Anytime you smell a bad aroma coming from the ears, see anything that looks red or infected, or something else you might notice in the ears, it looks like your morning coffee grounds. That would be the mite, the dirt from ear mites. So in any of those instances, I wouldn't even try to clean it myself, because ear problems can actually be very painful. I think a lot of us adults forget that, because most of the time we personally as humans have ear pain and injuries, or I should say infections, not injuries so much, but it's when we're kids. Some kids, actually have to get drains put in their ears, and ear pain is just, excruciating, but a lot of us forget. So we want to be so careful with our dog and cat's ears, and if there's any problem already existing, we don't want to be digging down in there. Now, I did another video last year, if you go back into the archive, that talked about ears specifically, but dogs and cats have much more L-shaped ear canals than we do. When you look down, it actually takes a right or a left turn depending on which way you're looking. So we have to be careful about, not shoving anything down. One of my big tips always about cleaning the ears is I don't like to use a lot of fluid and squirt it down there. Number one reason is because we simply don't always get it all out, and that in turn can cause this fungal or yeast infection that I'm talking about. I know a lot of the products say to squirt it down there, squish the ear around, and then let the dog shake his head and the liquid will come flying out. Not so much all the time, and my fear with squirting a lot of liquid down too is that any debris in there, sometimes we dislodge it, and that debris then gets flushed down that L-shaped canal and actually ends up sitting on the eardrum. So that's why I always prefer you dampen a cotton ball or a gauze cloth and just go down like your first knuckle and keep that clean. There are products you can use. Some of my favorites are either half purified water in cider vinegar or white vinegar. Some people mix the alcohol in with that, but that can be very drying. And also because very often our dogs and cats, scratch at their own ears, they might have things that kind of are similar to paper cuts that we get on the ears. And then when you get that alcohol in there, it will really sting. Another thing I really like cleaning the ears with is either green tea or chamomile tea. Just brew a tea bag in a cup, let it cool to room temperature, and then soak your cloth in that. Obviously, don't add sweetener, sugar, milk, or anything else to it, just the pure tea. Those teas have both antibacterial and antifungal properties, and the chamomile in particular is very calming. So it's a good thing to just, wipe out the ears with. But do make sure that the ears aren't infected. And for certain little fuzzy breeds, the poodles, the Bichon Frises, the Cotte de Toulouse, they often get a lot of fur that grows in there. So talk to your veterinarian or groomer about maybe plucking that out. You may not want to do that yourself. It can be painful for the pet. But sometimes when they get a lot of fur in their ears, it can harbor parasites, extra wax and dirt, and sometimes it makes it difficult for the pet to hear. So make sure the ears are kept clean. Next, I like going down to the eyes. And I like to do what I refer to as a tracking test. And I'm going to lift him up. You don't need to do this with your real pup, but just so you can see a little bit better. I actually want to be eyeball to eyeball with my dog or cat, and I want to take a finger and move it back and forth just a couple times. What I want to see, and I know I'm a little far from the camera today, but I want to see if that eye is smoothly following the finger. Often if you have a treat, the nose will do the work, so I just want you to do it a couple times with the finger and notice if the eyes are responding and if they are actually moving smoothly. If there's any kind of flicker or jump or the eyes seem erratic, I would bring it to my veterinarian's attention. It could be something called nystagmus. It could be like a neurological problem in which the whole dog's world is kind of off. Not like an inner ear disease, but similar. It's just, affecting the eyes and it's showing up neurologically. So that would be something you definitely want checked out by the vet. Another thing about the eyes you want to pay attention to are the size of the pupils. Dogs have little dark circles in the middle of their irises like us humans, whereas cats have vertical slits. Regardless, when they go in a bright room, they should get smaller, and when they go in a dark room, they should enlarge or dilate. So you want to make sure your pet's pupils are reacting to light and also that they are the same size to each other. Not to another dog's or cat's or your own, but the same size to each other. Sometimes if they are of unequal size, it could mean things like tumors growing in the back of the eye or in the brain. It could mean the pet has a concussion. We don't know. We don't diagnose. That's the veterinarian's job. But our job is to notice when something isn't quite right so that we can bring it to our veterinarian's attention, our pet's second best friend or their veterinarian, and hopefully get it fixed before it becomes a bigger problem. As you read through the blog, I'll take you through the whole parts of the body, but what I would want you to do after the eyes is just fill down the snout or the muzzle. Because of all the bone and cartilage here, it's pretty unlikely you would actually feel or see any kind of tumor growing. I mean, it can happen, but we're again trying to find things early on, and initially probably not. However, if something is happening there, it's going to be sore to the touch. So again, that's why you need to always be able to touch your kitty or your puppy in this part of the body, so that if one day you touch it and you know they pull away and it's sore, it's something you should get attention checked in. As far as the tip of the nose, whether it's brown or pink or black or whatever color it might be, it should be a happy medium. It should never be so dry that it's cracked or so wet that it's constantly dripping. And one other thing to bring to attention, if there's tenderness here, it may not be in the nasal cavities. It could actually be inside. So absolutely take a good look in their mouths. I know we always talk about puppy and kitty breath, but when we have dogs and cats, sometimes that can get a little bit more offensive. And dog and cat breath never really should be offensive. So make sure you're brushing their teeth. All of it, just about everything I've ever written talks about this. And I know you all think, well, wolves in the wild don't brush their teeth, but you know, they eat a different diet and they don't live as long as our domestic pets. So we want to do what's best for them. Without going into the whole dissertation, the food, the saliva, and the bacteria in our mouths forms plaque. And we basically have 48 hours to get it off our pet's teeth before it turns to tartar. Tartar are those brownish, yellow, nasty stains that get smellier and harder over time. And not only do they inflame the gums, they actually pull the gum away from the tooth. Microscopically, of course, at first, but over time, that tooth can fall out. But before that even happens, is the minute there's a gap between the tooth and the gum, all of the bacteria from the mouth can now get up between that tooth and gum into the bloodstream and travel to the brain, the heart valves, the kidneys, the liver, and so on. So it's just important that we keep our pets' mouths clean. So make sure you take a look. You also want to just really examine well, because if you have a dog who chews on bones, and you know the Pet Safety Crusader isn't a huge fan of that unless they are raw knuckle bones, but all cooked bones splinter and can pierce, as can sticks and certain other play items. You do want to look in their mouths once in a while to make sure they haven't you know, caused an injury that should be cleaned or see veterinary attention. Once you're done with the head, I consider the rest of the head to tail checkup kind of an all-over doggy or kitty massage without you being professionally trained. You're just looking at the coat, making sure it's shiny and that the skin isn't flaky. You're feeling for lumps and bumps and working your way down each leg, watching the pet's face as you go. Sometimes when you hit a good spot, you might even get one of those little Elvis lip curls or the leg going in the back. But other times you may hit something tender and be alerted to that. So it's important to pay attention to even the slightest little grimaces. Work your way all the way down to the pads of the feet. Make sure nothing is torn, that there's no hair really long growing between the toes, and that the nails are nicely trimmed. Keep a lookout for fleas and ticks and burrs or foxtails or whatever happens to be in your area. Continue your way down, and like when we were talking about last week, how to judge weight, make sure you can feel those ribs, but not see them, and make sure there are no hard spots in the abdomen, and that the pet is actually taking care of his own personal hygiene, or you need to get out that wet washcloth once in a while to make sure you know there are no infections occurring. Continue the same way down the hind leg, watching the face and checking the pads of the feet. And don't forget the tail, whether it's a tiny little nub on a corgi or a Manx, or if it's a long flowing Irish setter tail, make sure you feel all the way down it. Tails have blood supplies and nerve endings. They can get tumors, they can get cysts, especially with labs, they can get that happy tail, where they're always banging against something and get sores that are very difficult to heal. So the point of this is just to really tune into your pet. Put on a fresh pair of eyeballs, I like to say, once a week, and really notice those subtle changes, because they often creep up on us, especially as our pets get into their golden years. And the more that you know what is normal for your specific pet, the more quickly you can determine when something is not quite right. And I will say I've had many a pet parent and also a professional pet sitter really tune in and notice something not quite right, and get that pet the help he or she needs, and you know, really be the hero of the day and make a difference in the life of that animal. So it's true, we really shouldn't ignore things, and this goes all back to our own taking care of ourselves too, because if we don't take care of ourselves, we can't be the best caregivers for these pets. So get out to your pet when you're in a good mood. Make sure you haven't just got off a phone call that upset you, or that you're dashing out the door. Make sure it's a good space, you're in a good mood, a comfy place for you to sit down and cuddle with your very best friend and really get familiar with them. I want you to know what's supposed to be there and what isn't, so that you can easily identify it. Some of you have heard me say this many, many times before, but quite some time back, I was teaching a class, and one of the students was trying to remove the tick off the abdomen of his male dog's body, not realizing male dogs also have nipples. So my point is, really know what's supposed to be on your pet. Don't ever pull a nipple, or as pets get older, sometimes they get little tags or warts, and you might freak out and think it's a tick.
Make sure, if you're getting like me, that when you're doing these close inspections, you get the glasses on so that you can really see what's happening with your pet and take good care of them. This is the Pet Safety Crusader signing off for now. I'll see you again next week, and have a fun bonding time with your pet doing these head-to-tail checkups or doing it with your client's pet. It's a really good time to get to know each other, to settle down. It's almost therapeutic or meditative. And when it's all over, give them a treat, give them a good brushing, throw that Frisbee or whatever they enjoy best to thank them for having been calm and spending time with you. Bye-bye for now, and paws crossed for pet safety.